This is my mother's account of her as first being my mother and then also being my caregiver and also an advocate for me as an acute intermittent porphyria patient. So, Ma, I'm going to let you tell your story.
Okay. Good morning. And my name is Barbara. I am Jazmine's mother. And I'd like to briefly say, and then quickly get up to present day. When she was born, there were signs and symptoms that could have, we still don't know, could have been directly related to AIP, acute intermittent porphyria. However, we didn't know at the time. She was a fetal distress baby, as they labeled her. It was a perfectly normal pregnancy, but when she was born, she was not breathing. However, she was this fully healthy 8 pound, 13-ounce little girl, and she was beautiful. There was absolutely nothing wrong, and they had to revive her. They talked to me about the things that they saw that happened, such as aspiration of the meconium and all of these little things like that. And but then they came and they started to tell me, that basically the chance of survival was low. And of course, being a praying family and a praying mother, we still have her here today as a blessing to us. She did go through a childhood of repeat hospital visits, doctor visits that were a little more than the normal, where you just go for vaccinations and stuff. She had great battles with breathing issues. She had to see a pulmonologist regularly. We were in the ER regularly. She was called out of school, and she still maintained being an excellent student, an overperformer. Um, Moving forward into her young years, she went to in high school. She participated in sports. She was on the track, shot put and discus. She did weightlifting. In school, she was a very active child, but then there was always something that would say, okay, she had to be limited. And there was frustration by that, because she'd start something actively and be doing well, and then just out of the blue, these things would happen. She suffered from eczema. She, she would have these issues that would come up, and then as fast as they showed up, they would go away and they would be treated, and then, we go back to normal day-to-day activity. Um, then in college, I was contacted by the nurse, and the nurse explained to me that Jazmine had been taken to um, two hospitals in the Gainesville area. She was attending University of Florida, and she her breathing just didn't get under control. And they said that she had had several visits to them um, there on campus to the nurse, and they recommended that I bring her home and let her see a doctor. So I brought her home, and she saw some specialists. That was the first time in her educational career um, that she had stopped school, because she never stopped from high school. She didn't even take that summer off. She went straight on, and we were very proud of her. But of course, you have to have balance. So I thought maybe she needed a break. She was upset about it, but her health did not permit. So we brought her home, and we thought we were doing the right thing at the time by, getting the breathing under control and, getting her on the proper medications for that, and got her back into school. And of course, she sailed through. Um, and then after college, she ended up going to, she got, I'm getting the timeline a little off, I believe here. Jazmine, you might want to help me between UF After UF, you went to Miami, correct?
Mm-hmm. Yeah, I worked for about 4 months at a
Right.
pharmaceutical company, and then I applied for my master's program at the Art Institute in Miami.
In Miami, right. I guess I was trying to forget those little 4 months because I wanted you to keep going full speed ahead towards your career. And but you came back home then as well, and you were able to work those 4 months. You were doing great. Went off to AI in Miami. You were living with Nana in Fort Lauderdale, and then after attending there, you came back to, were you in Port St. Lucie with me?
No, I moved
Or you?
after I graduated. I moved up here for AmeriCorps.
That's right. You moved to Atlanta for AmeriCorps and was doing great there. And then you became ill.
Mm-hmm.
And I eventually I got a call. Well, you and I had spoken on the phone. This was the first thing that put a question mark in my mind as to if I needed to be there, or if you need to come home, or whatever the case was, because I said, she doesn't sound like herself. And this is where I think I first noticed the manifestations of when it was affecting your thoughts. Because before, when you were a child, Nana, would always tell me, I said, Ma, do you think da 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 da, with Jazmine, because, you would go off to yourself, you were always reading. You did a lot of isolated things, and usually it was geared towards reading or whatever, but it always seemed like your thought processes were a little bit um, evolved above a child your age. And because of the mental academics and all of that, the mental, the academics and all of that, that traditionally went on in the family on your grandfather's side and her, she said, she's a smart child. She's different. Leave her alone. Let her, explore and all of these things. And you were into the arts and all of that. And so, we encouraged him. We bought the art supplies and went to, all of those activities and everything. And but this time when I had this conversation with you, you started talking to me about proposals that you had to prepare. And you said, okay, Mom, we had spoken for a little while. And you said, okay, I have to go and work on these proposals. And I'll give you a call back. I said, okay. And something just didn't sit right with me as a mother. So I called you back. And when I called you back, you didn't behave like somebody who had just gotten off the phone with me. And I said, well, maybe she's trying to not be rude. I'm her mother. She don't want to, because you never really been a rude child or disrespectful. So I said, she just don't sound right to me. So I said, you know what? I'm going to call and do a well check. And when I called to do the well check, that was when I called you back. I'm sorry. I waited. I called, did the well check. I called you back. And you said, hold on, Ma, somebody's at the door. And you told me that it was your landlord. And so I knew something was wrong then, because I had never known you to just tell me a lie for just any old reason. And I knew I had called the police for a well check. You went to the door and I could hear you. And you had a full on conversation with them, very, very well spoken, sensible, like nothing. And they went on and went on about their way. And you came back and you told me that you had spoken with the landlord, and you were going to go on back and work on your proposals and stuff. So I got a little concerned. So I think at that time, either I called your manager, I think I called her first and asked her questions about, how you were doing and yada, yada, yada. And she said she had seen some things, blah, blah, blah. And she said, would you like for me to go over and check on her? And I told her what happened with the police. And I said, they don't know her. I know her, you know her. Um, could you go over and check on her? She said, yeah, I'll be happy to. So she went over to check on you. And you were working, you told her the same thing. And she asked me, did I want her to take you to the hospital? And I told her yes. And so she said, would you like to speak with her? I said, yes. I got on the phone. And you said, Ma. And at that time, your voice and your manner of speak became more childlike. It wasn't my adult daughter. It became more childlike. You were asking my permission and almost like you were trying to stay safe without saying, I don't feel like myself. And you say, should I give her my laptop? And when you said that to me, I said, she does need help. She needs to go to the hospital. So I said, yes, I told you to give her your laptop. And I told you don't give your phone to anybody when you go to the hospital. And you said, okay. And at that time, I was really thinking that, again, because you had set these goals so high for yourself, that maybe you were the young person overachieving into adulthood and that it was taking its toll on you. I wasn't thinking that you were sick, like, in your body. And you went to the hospital, and I stayed on the phone with you. And I recall this was the time when I recall a healthcare provider in the ER. I'm assuming she was the triage nurse, or at least the person who was taking your vitals when you initially went there. I don't know if she did any other assessing of you, and it was very hurtful to me because at that time I believe you had started to complain of pain, and she was mean. She was very mean spirited. She was, you need to sit down, and if you do that again, if you, because I think you got down on the floor, you were having abdominal pain, and if you don't get up from there, she was going to call the police on you. And I wanted to go straight through this. I don't want to cry because I was on the phone listening to all of that.
You want me to take a break?
And I think I can get through it. And I was trying to talk to you and encourage you and tell you it was going to be okay. And by me being so far away, because I was in St. Lucie County and you were in Atlanta. So that was a long way for me to protect my child. And basically, they discharged you and gave you no help. You went out into the parking lot, and I was on the phone with you, and you did not recall that you had been dropped off. You were looking for your car. And at this point, I became frightened because I felt like you were alone and you weren't totally capable of making safe decisions because you were thinking that your car was out there and you couldn't find it. And so the one bit of comfort that I did have was that you seemed to know that, as I had always told you, all of your siblings, call me. If you're afraid, if you don't know, don't talk to nobody but me. So you seem to have that understanding. I'm gonna call my mom, and I'm gonna keep my mom on the phone. And you did that, and I explained to you that Carol had brought you there and that your car is not there. You wouldn't find it. And I reassured you because you were concerned about your work, that she had your laptop, that nobody else had it, and that you would be able to go back and do your work as usual when you got back home. And of course, I was still concerned that nobody had helped you. You were still in pain, and I failed to mention that, early on with the call. And So I think she came back and got you, or was it the other young lady?
I don't remember.
I think Carol came back and got you, but at some point, because you continued to go to the different hospitals in the Atlanta area, which I was terribly disappointed with the way you were treated. And another young lady that was a friend of yours at some point picked you up from the hospital and took you home. Um, mm. So after that, I believe it was a point where this was the point where you went to Grady. You ended up at Grady. And for whatever reason, and I'm sure that this has probably happened to other Porphyria patients, and this is where I feel like, as a healthcare provider myself, that they need to do something about it. When they don't know, they should not just naturally assume that somebody is mentally ill and place them in the mental health ward, because that's what they did to you. And of course, once again, I was so thankful. I was thankful to God, and I was grateful that you heard me and you trusted me as your mom, that I will always do my very best to protect you. Because you called me and said, Ma, these people have me up here and they won't let me go. And excuse me. And so I knew I had to get there. Now, my heart knew I had to get there, but I had never driven past Gainesville, Florida when you attended University of Florida in my life. And at that time, I was working the 3 to 11 shift at the hospital. So I had to figure out how I was going to get my nerves together so I could do this. So I worked all day. And I went and picked up your little brother from home and packed up and got on the road. I was on the road by 12, a little after 12. And I just said, I got to make it. Of course, I think I stopped one time to get gas and coffee, and I don't even drink coffee, but I fell asleep driving on one of those back roads. I had no idea where I was going, just following what the navigation was telling me. Family of deer on the side of the road. It was pitch black, dark, no street lights. I still, to this day, don't know what city I was in or what road I was on. And I fell asleep driving, and your little brother woke up, and he said, Ma, what are you doing? I said, we got to get the Jazz. He said, you got to stay up. You got to stay up. And I finally made it to a gas station. Got the gas, topped off the tank, got the coffee. I made it to Tallahassee, where your younger sister, Alexandra, was in school at FAMU. And she told me, she said, Ma, we'll take you, her and her boyfriend. We'll take you the rest of the way to Atlanta in the morning. So we made it there. And of course, they decided they were going to try and tell me or convince me that you were not the child that I knew, that you were a liar, that you were having some type of psychological break. And basically, that was the way you were going to be, and that you needed to be on all these medications that they were prescribing and that they knew best. And basically, I looked at the doctor to sum it all up after we were in this little room together. And I looked at him and I told him, I don't know which one of these doors leads to my child, but you don't have any right to keep her. And I want you to go get her and bring her to me. You can't help me. And apparently you can't help her. Give her to me. And your younger sister got scared. She balled up. And she said, Ma, you didn't see your expression. But I think everybody in that room knew they better go and get her. Now, I thank God If I had not gotten there when I did, they may have made you that person that they were trying to make me believe you were. Those people had tormented you to the point where if you wouldn't take the medication, and this is what you told me clearly, if you wouldn't sit down, if you wouldn't take the medication and do what they were telling you to do, if you wouldn't talk to them, thank God you didn't talk to them, that you had to go to your room. And that's when that independent little girl who used to go and sit and do things alone and teach herself and just explore all of her thoughts, that came into play, and you kept your mind because you knew I was on the way. Now, when they brought you to the door and I saw you, you appeared to be a shell of yourself. Your clothes were hanging off of your body. You looked very disheveled, but you were mine. And I was angry. I was grateful. I was thankful. But I was angry at what I saw because nobody should allow anybody in their care to get to that stage and they don't help them. Okay. So we took you from there. We went back to your place. And basically, we got your things together. And I brought you back home with me. And there were some days where you showed improvement as far as the pain and your thoughts. And I think being in the comfort of home and knowing that you were safe and familiar faces and things, that made it better, but it still didn't take away the pain. It didn't take away the disorientation completely. So we ended up, you were at Lawnwood Medical in Fort Pierce, Florida. And because of the pain, there was nothing that we did to take the pain away. So at that point, they decided to remove your gallbladder. And they removed your gallbladder thinking that was the issue. They placed you on tramadol, which you didn't have the best response to. And if you want to say something about how it affected you there.
Well, the tramadol was, they were saying they were giving it to me for the pain, but it was also inhibiting my ability to think. It was making me even more deal with even more insomnia than I already do, because the nighttime somnolence is one of the symptoms of porphyria. So it was just exacerbating the things that were already going on. But at the time, I hadn't been diagnosed with porphyria yet. So
Right.
no one knew what was going on. But that particular tramadol was taking me even further away from my normalcy.
Right. And they also put you on risperidone,
Mm-hmm.
which I think they thought that was going to help control, and to some degree, maybe I don't know what they were thinking. But they decided the next day after taking your gallbladder out, was it the next day or 2 days later, that you were to go home, you were to be discharged.
Mm-hmm.
And I kept begging them, can you please let me speak with her doctor? And the doctor wasn't available for whatever reason. And they said that the hospitalist, I believe it was, or the PA, was working on your discharge. And I said, I want to speak with that person. I was very upset. And I will be honest with you, I had a moment that I was ashamed of and proud of at the same time, because it was, at that time, Jazmine was experiencing projectile vomiting like nothing I had ever seen in my life. And I worked in the hospital. Um, the I got so upset because I was begging for help, and nobody seemed to be listening to me. And I kept saying, "You can't discharge like this. What am I supposed to do at home? She's in the place. You all are supposed to think outside of the box and help my child. You are supposed to find out what is wrong with her. Where else could I take her if you all aren't willing to go outside of the box?" I said, "Please think outside of the box," so many times. And to be honest, I don't even know why that phrase came out of me. But I just felt like it was not normal to watch you having the same pain, more severe, and then added on the projectile vomiting to that degree. This was not just regular, I've been on anesthesia. This was, my body is trying to get rid of a poison. And I didn't know what to think. At this point, I was wondering, did somebody do something to Jazmine? I really didn't know what to think. And at that point, I was afraid, because I knew if I took you home, that without them giving me guidance and giving me the proper follow up care, what was I going to do? Was I going to watch you continue to dehydrate yourself? You were unable to eat anything, you were unable to drink anything. I saw you get to the point of projectile vomiting, and it was almost like a dry heave at points. And I'm going, how could they do this? And I ran around the nurse's station and I started beating on it. And it reminded me of a moment in a movie. And I felt like it wasn't my real life. This couldn't possibly be happening to my child, and definitely not to a human being. I just, I couldn't fathom, because I knew that I could never do that to another person. And I begged and I beat and I whined and I cried, and I I put it all out there. I just pleaded with everything that was in me. And a nurse came up to me and she said, "Ma'am, the PA is right there. She'll speak with you for a moment, but she is very busy." And I went over to her and I said, "Well, can you just come and take a look?" And before she could get up to take a look, they had put Jazmine through all of this. They didn't even care. She was vomiting, had an emesis bag in her lap. And vomit was not going in the bag. It was going all over everywhere. It actually flew out forward towards the nurse's station. And they were still pushing her up there in the elevators. It was going in that direction. And I'm thinking in my head the whole time, these people are out of their mind. How can you discharge somebody that is projectile vomiting even towards the nurse's station at where she's got to get her discharge, and towards the elevator where she has to get on and leave? And when the lady saw her like this, she turned to me and she said, "This is going to be the fastest readmit in history." So while she was doing the discharge papers, she realized in that moment, I don't know if it was my behavior or if it was her assessment of the situation when she saw it, or what it was, she immediately had them turn Jazmine around. Now, of course, me begging and begging and begging, please think outside of the box. Please think outside of the box. I don't know if they did, but I didn't see anything that uh, produced any new ideas on how to treat her. They kept treating the individual symptoms, and nothing was working. So I felt they still discharged her prematurely because they did not find a way to alleviate the extreme pain, the nausea and vomiting. It never went away, ever. Um, so eventually, I don't remember how many days it was, they discharged her. I say prematurely. And they referred her to gastroenterologist and a psychologist. The psychologist for therapy and the gastroenterologist for treatment with the nausea and vomiting and all of that. And this particular doctor was very caring, and I appreciated that they were willing to try and think outside of the box, but not in the sense of, I won't say they didn't think in the sense of what they were treating, but again, they were looking at symptoms. And I think this doctor said, well, we have something that is a new trial medication and it requires prior authorization from the insurance company for such situations. We don't know what's causing the situation, but we're willing to try and get pre-approval to give her this medication. Of course, this medication seemed to be as hard to get as Panhematin was later on down the line at this time, but it was a lot of phone calls. It was a lot of pleading and explaining, and it was torturous because during this time she was still suffering and she had a lot of pain. She was going through a lot. She couldn't keep down anything, even liquids. I was afraid that she wasn't keeping enough nutrition in and hydration in. And that was the reason I wanted them to keep her in the hospital because, of course, I had no IVs at home to give to her or feedings that could be given to her. So this doctor got her the medication by giving her samples from their office while we waited for the insurance to approve the medication. But we ran into that same issue of every time she ran out, even if we started a week prior, because I think that was the largest number of days you could put in for the prior authorization, there was always a gap in getting that medication that was somewhat helping with the nausea and vomiting and projectile vomiting, all of this thing. So she lied in bed weak and not well for a very long time. After that, her being the go-getter, that I'm gonna meet my goals no matter what. I am getting a little bit more. I'm able to take in, I think at that time you were taking in the vegetable broth. And I forget, you were drinking ginger.
Water, Gatorade.
Water, Gatorade, the vegetable broth. I actually, there was one that she was able to tolerate because she couldn't even tolerate every vegetable broth. I'm trying, what was the brand, Jazz? Imagine. So I ended up going to Publix and they ordered it because they seemed to have every other broth on counter. But they didn't have that one. And a young lady that was stocking the shelves said, ma'am, I'll help you. It'll be a couple of days. She actually called me the next day and said, I have it here for you. And so that was how we were able to start to get nutrition into her and hydration and all of that. And she started to feel a little better. And she told me, I forget what solid food we eventually got her up to. And she said, I want to go back to work. And she was in AmeriCorps and try and get this going. AmeriCorps was very, very kind and understanding. Very, very kind and understanding. So she eventually went back. She said she wanted to go back, and she started back working and everything. And oh, I skipped something, Jazmine. While you were home with me, because this was a longer process. This was a month.
Mm-hmm.
While she was at home with me, she it was some months, and a coworker of mine that worked in the business office at the hospital had been to a conference, and she met an administrator with the Social Security Administration, our district. And she recalled that she had met this person, and this person was very nice. And she said, Barbara, maybe you should call this person and talk with them and see if they can, at the least while your daughter is not working, and she has all of these needs, she may be able to get disability benefits. And she gave me that number, and I left a voicemail, and she typed up a letter to that person explaining everything that Jazmine had endured up to this point, just as I am talking now. Um, and that person got back with me and told me what to do, and we were able to get the process expedited. And at least in my mind, because I had always heard that people have to wait a year or so on, sometimes longer. And this went in a few months. Jazmine was able to get her benefits, and she was able to, get the medication she needed and the treatment as best as these providers could do without them thinking outside of the box. Again, I keep saying that healthcare providers need to always, after their initial assessments, they need to be thinking outside of the box if the answer is not there. Um, so she went back, um, and she started, I guess, on a smaller scale, returning to her duties back in Atlanta at the organic farm where she was working. And I felt better. I was able to breathe, but the brick was still on my chest and weighed on each of my shoulders. But I felt a little more relief because I knew that the people she worked with loved her, um, and they would call me at the drop of a hat. They were watching. They knew what to watch for at this point. Um, so she, I'm trying to remember. You went back.
I say this is when I was working for like probably a couple months before I went into renal failure.
Right, but this is what I'm trying to think. Like, at what point am I getting it out of order? And I'm so sorry, Jazmine, but it seemed like I'm trying to remember if you went back to Atlanta and then you had to come back to me again. I think because remember,
No, that was after I was diagnosed. Was when I came back again.
okay, okay. So you were diagnosed. Okay. So what happened was you returned to ATL, and shortly after you went into crisis, and you then went to Emory.
Mm-hmm.
That's when you went to Emory, and they said you were close to renal failure.
Mm-hmm.
But when they called me, they didn't say close to. They said her kidneys are failing. And if they don't start to rebound, we're going to start dialysis.
Mm-hmm.
And so,
And I was severely dehydrated, and also.
Right. Because they never quite got that vomiting completely gone.
Mm-hmm.
And so your admission there, which I am so grateful for them because they kept you and they began trying to think out of the box. And I think that's the great thing about going to a teaching hospital, because you have multiple minds from all different walks of life and different educational experiences, where people were in school and saw different things during their educational walk. And Dr. Anderson came in with his students. And I have never met this man in person. Another practice that Jazmine and I started with back then.
Not Dr. Bruce Mitchell.
Dr. Mitchell. Dr. Mitchell. It was Mitchell. Because Dr. Anderson was when you later on.
To Galveston, yeah.
Right, in Galveston. Um, Dr. Mitchell came in with students, and he said to me, and this was a practice that Jazmine and I had started way back then, and we still continue, even at home. We do FaceTime. So what it is my rule is that any family member that's in the hospital, everyone does not need to visit at the same time, and you take shifts because someone always needs to be there. And because Jazmine was in Atlanta and she really had no one there, I told her to always call me and have me on video. So if she fell asleep, if someone came into the room, any of that, give them authorization, which was on her chart, to talk to me. So she was awake, and Dr. Mitchell came in, and he came in with his students doing rounds. And he said that he had to, bring it in. He had gone over, everything thus far with Jazmine, and that he had a patient during his internship at the Mayo Clinic, and he had only seen one patient that reminded him of Jazmine, and he felt like it was a shot in the dark, basically, because it was a white male in his early 40s that presented with the same symptoms, almost to a T. And he had acute intermittent porphyria. And he said, I'm not sure if this is what's wrong with your daughter, but I don't believe so because history has shown that it is a very rare condition. And it is even more rare that a person of color, a black person, would have this diagnosis. And he said, but mom, this is what I'm thinking. And so I didn't miss a beat. And I turned to him and I said, could you test her? And he said, to be honest with you, I don't have any idea of the protocol for testing. And I said, okay. And at that point, I trusted that he would look into it, but I realized it was a teaching hospital. He had those students. He had a full docket. I'm going to say docket. I know it's the wrong term, but I want to try and get through this. I know I'm a slow talker, and I'm trying to recall things in order. And so by me working at the hospital, and I worked 3 to 11, I decided to get on the computer. I got on the computer, and the first thing I did, of course, was type in Porphyria because I asked him how to spell it. And I was working in medical records at the time, doing chart analysis. So I went in, and what came up was the European Foundation. And so I went there, and I think I sent them an email or something, but I didn't have a whole lot of hope because I said, it appears like he said that this is something that's more, with the European persuasion, and then this is a European, an actual European foundation, like, England and all of those. They may not respond to me because I'm in America. which later, if I recall correctly, they did, but not right away. So, of course, I immediately kept it moving, and something told me American, I'm in America after I saw that, and APF came up, the American Porphyria Foundation. And I took down their information, um, and then I started to YouTube videos, and I just put them up to watch while I was working. And of course, the things that I saw looked like what Jazmine had been going through in a lot of ways. The only thing that was different was the extreme outer issues with the skin. Um, so I said, well, she's not having, her nose wearing away or her ears or any of that. But all of these other, the disorientation and scattered thoughts and, the vomiting, the pain was the big thing. She was in extreme pain. And so I called the American Porphyria Foundation. And of course, I don't think I got anybody that night. I got a recording or something like that. And the next day, I called again and I got Desiree, who was CEO or something. And I think she was one of the founding members or what. And she was a very nice lady. And she explained to me that she actually had porphyria herself. And if there was anything that she could do to help me find doctors, all of this stuff, she would. And she referred me to the site, as far as the medications, because I was concerned about them giving her the wrong thing because they didn't know what they were treating. They were just, shooting in the dark kind of thing. And I know that early on that tramadol and the risperidone was not the cocktail for her. So she told me, yes, I will send you the protocol. That's no problem. She immediately emailed me the protocol to the hospital. I printed it out and I immediately faxed it to Emory, to Dr. Mitchell. Dr. Mitchell tested Jazmine, and 3 days later, he came into the room and he said to us that that was exactly what it was. Now, he was amazed. Everybody that had been treating her was amazed. But Jazmine and I were not amazed. And this is where I go to say, think out of the box. When it comes...
I'll say, and at that point, I had been in the hospital for 14 days before they tested me for porphyria. And my entire stay that time was 28 days.
Right. Now, what I will say is him saying what he had to say, me being a woman who believes in God. I feel like because of what Jazmine had already gone through, and in this span of us talking, this had been probably, a couple years, you going through all of this suffering. I feel like it had to be God to send that particular doctor into that particular room. And he and I have that conversation with Jazmine. And I think the research on the computer and what I found, getting a hold of Desiree, getting protocol, and getting it to Dr. Mitchell. I feel like we're all blessings that lined up. Now, once he found that out, he did, the testing, got the diagnosis and everything. Then, of course, we hit another wall. Because now it was the issue of pendimetin, how hard it was to get it and get it authorized by the insurance, and getting someone to give it to her, find out how much she needed and what would bring her back to normalcy, how to incorporate it into her medication regimen and get her back to a normal life, to the Jazmine that we all know. It took some doing. And I apologize because I'm bad on time. And I will be honest with you, from her birth until now, so many doctors' visits, so many healthcare providers, so many conversations with medical care providers, those who were interested enough to hear us and try, and those who were brushing us off. It has been so much until I am grateful and so thankful that she and I both have made it, but her most of all. But me to be here and her to know that I'm always here to be able to speak on her behalf and ensure that nobody is going to overlook her, that she's going to be given the treatment that she deserves as a human being. I was grateful. I will forever be grateful to Dr. Mitchell and all those who took part in getting her.
And Dr. Hawk, the internal medicine doctor.
Yes. And as I said, there were so many people, and some of the nurses. Oh my goodness. Just grateful. And the fact that they tried. Even there have been and there still are people that come to treat Jazmine, even when she goes to get her infusions to this day. I don't want to get ahead of myself. That seem so interested in learning. So interested in learning. And that goes to show, and I have to say this right now while it's on my mind, it goes to show that there are still people in the healthcare industry. I mean, there's still some that just go into it for whatever reason, thinking they're going to make a lot of money or whatever the case. But there are still some people in the healthcare industry who genuinely go because they want to help people and they want to learn. And I feel like rare diseases such as AIP and rare situations that could occur, such as a person of color, a black woman, could show up and have a condition that is not typical of what appears to be her race. Because what they did not know was that Jazmine's maternal great grandmother, although she was mulatto, she was looked upon as the government at birth, throughout her life, and in death. They documented her as white because her mother was white. And she presented to society as a white woman. And this was someone who never discussed race. And to this day, we are still, up to last night, Jazmine and I are still looking at our ancestry. And because of how she passed away and the symptoms that she experienced prior to her young death, she was what, 33?
Yeah, I think so.
Yeah, she passed away very young. They didn't have the care that they have now for porphyria patients. But because of how she passed away, the symptoms that my grandmother told me her mother had prior to her dying were very similar to what Jazmine experienced. Very, very similar. And then her daughter, my maternal grandmother, who was documented as a white woman, passed away of another blood disorder, leukemia. So I feel that I am grateful to those who are still in it for the right reasons and who genuinely care enough and who take the time, who make the time, because we all know in healthcare that it seems like you never have enough time. But making the time, and I feel like that is why Jazmine was diagnosed, because somebody finally heard think out of the box. Somebody finally had that little twinkle inside of them to have compassion enough for another human being that they saw suffering and say, you know what? I'm going to start thinking. I'm going to go back into my memory bank of what I have seen and what I have learned, and I'm going to help this young lady. Okay, so I'm off the soapbox, I think. Um, so we got to her diagnosis, and finally we got the panhematin for her.
And
Jeff,
that was in 2014, because I just want them to know, like, I was diagnosed in March of 2014.
right. So after you were diagnosed, you received the panhematin. At that time, they gave you how many infusions?
They gave me 7 infusions.
7 the first time.
Mm-hmm.
And of course, there was a turnaround in her health.
Mm-hmm.
She was able to get up and get out of bed. She was able to walk down the hall, and eventually they allowed her to go downstairs and sit in the sun. Because remember, she had been in the hospital in total.
At that point, about 20 days.
Right. So I'm grateful for that. Now, after that, she was discharged. And how long, I don't remember how long it was before you came back and started to get your biweekly infusions.
Let me see. After that, so I finished with AmeriCorps in Atlanta, and then I moved to Tallahassee to do AmeriCorps. So I moved up from an AmeriCorps just a member to being an AmeriCorps leader at another location. So once I went there, the issue was I wasn't able to get my panhematin in Tallahassee. So
Right.
again, that started again with me going through the Porphyria attacks. And after that, I was in Tallahassee maybe 4 or 5, not even, probably about 3 or 4 months um, before I moved back with you, St. Lucie County.
Right. And at that time, I you became ill
Mm-hmm.
while you were there with me, and you had to go to the emergency room.
Mm-hmm.
But you didn't go at the main hospital. You had to go to the new location,
Mm-hmm.
um, out in Tradition. And while you were out there, there were the doctor and the pharmacist. Here we go again with we can't get the panhematin.
Mm-hmm.
So I get off work. I was then working the day, long since working the day shift now. And I go after work out to the hospital, and they're in the hallway talking about you. So here is where, again, I became angry and protective. And I didn't say anything. I just stood there behind them and listened to their conversation. And the reason why I did that was because, number one, being your advocate, I felt like that was a HIPAA violation. Don't stand in the hallway outside of my daughter's room and converse about her where anybody walking through the hall, whether it be patients, staff, or visiting people, can hear what's going on with her. And the other thing, while you're standing here looking at each other, couldn't some phone calls be made to who previously treated her and find out what they did? That would be the common sense thing to me, to get the panhematin. Call her insurance. What did they do? What was required for prior authorization? Whatever the case may be, to assist this young lady who is laying here in pain, disoriented, and needing help. Again, try to always be in the hospital with your family member. It's hard. I know people work. I have been working all these years throughout this time, from Jazmine being a young girl, off and on, I was working. I worked for the state of Florida, Agency for Healthcare Administration, uh, juvenile justice. But you have to, as an advocate, as a parent who loves their child, you have to be there. You have to rally people who are willing to help you be that support team. Not one, it's very hard on one person, and it's almost impossible the way society is set up for one person to do it all the time because people have to work. People have their own families, that type of thing. But we didn't go, well, I didn't get to touch on when you were in Tallahassee. Again, you were there with your sister. Mm-hmm. And she had done everything that she could in those 3 to 4 months to be there for you, be your advocate as well. And she called me crying, you know, and she said, Mommy, I've done everything I could. And I don't know what to do to help. You have to come and get her. I don't know what to do. Okay? So, of course, we brought Jazmine. Now we're in the hospital with her. And they had you like in a holding room. What was it? ER. Mm-hmm. They hadn't moved you to a floor or anything. And I'm still kind of cloudy on that. I don't recall if you ever even made it to the floor. But we had an oncology nurse come in. Because at some point, I'm missing when you got the first port.
I got the first port when I came back. This time when I came back to St. Lucie, I went to
Vero.
Took me to a hospital in Vero, and that's where I got the first port put in.
Right. And then you ended up in the hospital. Of course, Vero was far away from Port St. Lucie for us to get you back over there. But they were just to put the port in anyway. Mm-hmm. We were in the process of trying to find somewhere to get you the Panhematin. Mm-hmm. And you ended up in the hospital. And to shorten the story a little bit, when I returned to work, I had been speaking with my immediate supervisor and some of the others in the hospital that I thought could help me, because I said, listen, she's at our other location and she's not getting what she needs. And I was walking up the hall to go upstairs, and the CMO was coming out of his administrative office, and he stopped me because he was aware of who I was. And he said to me that he felt like it would be best for me to take Jazmine to a larger city because they would be able to get the Panhematin more frequently and have it on hand, because the chances of them having another Porphyria patient and having some of the medication on hand if she went into crisis, at least to get the first infusion going before they had to go through all of the rigmarole with the insurance and the pharmacy that made the Panhematin, could be done. And I was a little hurt initially. I was hurt because I'm like, but right now she needs help. You telling me to go on a wild goose chase for a bigger city. And a bigger city means an hour away or more, like, help me now. And I did say to him, is there any way that you can help me now to get her at least stabilized? Can y'all, call and get what needs to be done? And in that situation, of course, they were giving you the glucose. And we got it set up where you had to go to West Palm Beach. Mm-hmm. Now, I don't know, and I was very grateful to these people for getting you your infusion. Mm-hmm. But I still, to this day, couldn't understand, again, now we're in a bigger city, why we had some of the pushback and some of the delays that we had even over there. Mm-hmm. I mean, I don't know how much bigger you were going to get than West Palm or Miami in South Florida than returning to Atlanta. And that wasn't an option at the time. You were unwell, you needed your support system. You needed someone to advocate and talk for you. When a person is having a crisis with porphyria, the pain is so overwhelming. And this is another thing we need to address. Every person of color is not seeking drugs. I'll say it again. Every person of color is not seeking drugs. Jazmine did not come from a household where she was going to be seeking drugs. I don't drink, smoke, alcohol, street drug, nothing. So this was offensive to me, and not just for me and my child, but it was offensive. And it is every time we have to deal with this in the emergency room. It was offensive because statistically, we are not the largest population in America. So if you look at it as a whole, statistically, we are not the greater users and abusers of drugs in America. I'll just say that and leave it alone.
Especially prescription drugs.
Especially prescription drugs. But, and I want to leave it alone, but I just keep, but it's because you have to look at each individual as a human being. And when a person, however, she was new to West Palm Beach, she was new to this particular hospital in Port St. Lucie. She had been to the other hospital in Fort Pierce. But if a person gives you their history and they give you their doctors, take the time again, invest in your patient as a human being and go through. Why are you asking them their history if you're not going to do the work? Contact the previous provider and find out what the protocol was that helped this person. Don't allow this person to lie and suffer for days on end. It's ridiculous and it's inhumane, and it has been in every situation, I feel, since she has been going through this. Each time she's been treated this way, I feel like I want to scream, and I don't know why, but I can't scream. But I don't understand treating another human being that way. It might be a little extra work you might feel, but I think it should be the norm. It should be a part of what you do if you're a caregiver. Okay, moving along. Jazmine began to get the Panhematin treatments in West Palm Beach. And she began to improve, of course. And then she was able to move into her own place because my place was small. And she was able to move in with a family friend, a senior by the name of Miss Nicey. And I felt like Miss Nicey was a godsend. You would have thought that she reminded me of my grandmother that I spoke about earlier because she took care of everybody. And Miss Nicey said, she can come here with me. And this is somebody that she at times needed care herself. And her daughter was my very good friend. They embraced me and my children as their family. And she was an older woman from Jamaica. And she would get on her knees and she would massage Jazmine's feet when she was having the neuropathy. And she would, she would just take extra care with her, like as if she was her own baby, not even being a grown young lady. And she's gone on since, but I will forever be grateful to her because she was doing that for my child. She was stepping in as a part of my support team. in taking care of my child when I had to be at work and couldn't do it. And I will forever love her for that and appreciate her for that. Jazmine was able to get stronger and to deal with what was going on um, later on.
That's why I started getting my infusions twice. Um, it was twice a week for
It was,
twice a week every other week. I was getting my infusions.
that's how it started.
Mm-hmm.
Okay, so it didn't happen. Okay, so what you're doing, the protocol now changed when you
Mm-hmm.
moved up back to Atlanta.
Mm-hmm.
So after that, Jazmine was unable to work during that time, but she was able to work on herself. She was getting her treatment, and she was getting stronger. She was having less pain, and she was able to figure out during that time. And you will see that for a lot of people, and I'm not saying this is for everybody, but during that time, I think it was that Jazmine realized that a plant based diet
Mm-hmm.
was more beneficial to her than taking in meat
Mm-hmm.
as a protein. And she had already been working at Truly Living Well, where the majority of the staff was vegetarian or vegan.
Mm-hmm.
And so she was practicing vegetarianism for the most part then anyway. And I believe that that could be a part of what preserved her life and that gave her what she needed to fight through these traumatic crises. Because I believe if she had been taking in meat when she could eat and her body hadn't already been kind of taken care of, that she probably wouldn't have had the fight that she had. Because during that time, how many pounds you lost when I came up there that first time, when they had you in the psych ward and they stole your cell phone? I remember that
Like
because,
a lot, like probably like 40 pounds, like
yeah,
30, 40 pounds.
that's why your clothes were hanging off of you. And the only thing I recognized was your face and your voice. And I didn't say all of that initially. And she said, Ma. And my children always call me Ma. And when she said Ma, everything in me felt like it was going to implode. But again, I'm her mother. I got to stand when she can't stand because she's mine. Um, Going past with Miss Nicey, Jazmine then was recuperating. Um, I believe when she was at the house with me, she said to me, because we had set up like a hospital station in my living room of my apartment at the time. And she said to me one day I came home from work, before she went to Miss Nicey, she said, Ma, she said, I want to go back to school to get my doctorate. And I said, you can do that. And I went and put my purse down. And I came back around the corner and I said, Jazmine, I said, have you researched to see which schools have your program? And she told me, I think there was a school in California. There was a school, I believe, was it Miami?
Mm-hmm.
And at Atlanta,
Mm-hmm.
at Georgia State. And I told her, I said, well, if you want to go back, then you should go back. I said, why don't you start applying? And I believe that that gave Jazmine the push because learning learning and researching has always been her thing from a little girl. She wanted to know why. And she'd find her why, and then she wanted to know how to get it done. And I believe that helped her also. And she went to Miss Nicey. Miss Nicey helped her with her pain. She gave her, what was it? Was it moringa?
Moringa, yeah.
She gave her moringa. Um, She tried to keep everything as natural as possible. I'll never forget, I was about to get off work one day, and the mayor had called me, Miss Eula Clark, and she said, I know that you said your daughter, has to have a vegan diet. She's doing better on that, and I want to help you out. And she said, I have these jackfruit. And I had no idea what a jackfruit was, but Miss Nicey knew what it was. I went over there, I was in my scrubs, and I had never been to her law firm. She's also an attorney. And I found her law office, and she was standing there waiting on me. And she put this big thing in my car. It was larger than any watermelon I had ever seen in my life. And we got it in the car. And I took it, and Miss Nicey explained to Jazmine, how she could cook it and use it. And that was a wonderful thing. I always remember her um, for that. And to this day, she always, whenever we speak, she asks, how is Jazmine doing? Again, I say you have to have a team, and it may be small things that they do, but it helps. It encourages, even if it's something psychological, to know that somebody cares enough to say, let me help you out with a new something to incorporate into your diet, or to rub your feet, or to just call and say, how is she doing, or speak to her directly, how are you doing? She applied, and I told her to make sure that she explained when she applied, you know, uh, as a part of her application.
My personal statement.
Personal statement. And she did. And Georgia State, woohoo, they said, yes, we want her. And she went back. And she was able to get with Dr. McLemore,
My current doctor.
her current doctor, and he set her up for biweekly infusions at Emory. Now, this has not been a perfect run either. There have been times when I don't know how it happened or what happened. She was given human albumin with her infusion, and she began to get very, very ill. And she did not know why. And one particular day, she was talking with the pharmacy at the hospital when they were in preparation of her treatment, and they happened to mention that had been a recent change. And she noted, I shouldn't be getting that. And so at that time, she was advocating for herself. And she called me and she told me, and so I told her, as a regular practice, it may seem, some of these things may seem redundant, and they can become taxing on your nerves, because it's already hard to be a porphyria patient. It's already hard knowing that you have a diagnosis that says you are rare. Everybody is not going to know. You're going to have to explain what your condition is and how to treat it to 90%, if not more, of the caretakers that you may have. But I continue to encourage her and ask her to just go ahead and speak up for herself when I can't be there. And in the case of when she goes for her infusions, each time to make sure that she either looks or she asks what they are giving her. And if it's something new, why? Because we want what is working to continue to work, and what has not worked in the past to never be given again. And it's not easy. People with rare diseases and conditions, and having porphyria specifically, we need change. We need teamwork. We need advocacy. And we need compassion. we need understanding. We need people to understand that this is not easy. And we can, people can say, and I'm thinking that saying that it's not easy is an understatement. And the reason why I say that is because the average human being will say, getting up, going to work is not easy. Starting a new exercise routine is not easy. And so people just blow it off. No, it's extremely hard. At times, it is unbearable and it seems like it can't be done. And this is why our Porphyria patients, they need a team. They need family, they need friends, they need healthcare teams and staff members who care. The ones who don't care really just shouldn't be in the field, but I have no control over that. But this is what they need. They need a team that genuinely cares. Because just because you are a small number, it does not mean that you don't matter. They are human beings who have a condition that they did not create. And because of this reason, they should not be treated like drug seekers. They should not be treated like they're mentally ill and out of their minds. They should be treated as human beings who deserve our care and proper care. And I'm going to say it until I'm no longer here. And hopefully there will be other people who will feel the same as I do, and they will continue to say it. And that one day it won't have to be said over and over again. I have encouraged Jazmine. This has been a 10-year journey for her as far as from when she came to me initially and they removed her gallbladder. And I hear that is a commonality amongst many of the Porphyria patients. They need to stop this.
And I also want to say, with just some of the complications, even since I've been on a regular care routine, that with the uh, the formulation of porphyria, it's a and having to get panhematin, it's a very thick substance, which is why you have to get the port. So I have a new port now that I got in 2020 because my first port stopped working, which is also a common thing. They say on average they have to be replaced every 5 years. So that's something that's constantly, on this porphyria journey. You have to, that's also surgery. Even if they consider it a minor surgery, it is a surgery that you have to continue to get. And then also, um, even with getting the panhematin, my body rejected it the first time that I took it, because I'm allergic to it. So I have to get Benadryl before I actually can even be treated for the porphyria. So as a part of my routine, that every 2 weeks I have to get IV Benadryl first before I can get my panhematin treatment to treat the porphyria.
And those are other things that may or may not be occurring with other people. And of course, we know when you first started getting your treatments, they made it very clear that panhematin was only made in one pharmacy.
Mm-hmm. One pharmaceutical company out of New Jersey. Mm-hmm.
And that was the only treatment that they had. And since they've come up with, I think I'm pronouncing it, Geovasarin.
Yeah, Geovasarin or Givlari, I believe is the brand name.
Right. And so there may be people out there. Of course, we know with all medications, there can be side effects. There can be adverse reactions. Different things can happen with medications. And so there may be a person out there, like Jazmine, for instance, has looked at the new medication. And although she did go before the FDA herself and speak for more treatments to be available, and she was in a trial, that's how she was. I think I skipped over that when you went to Texas to the trial
Yes. When
with
I
Dr. Anderson.
when I wasn't able, that time when we were having issues with getting me on a regular Porphyria regimen because of the insurance issues, we found Dr. Anderson, Dr. Carl Anderson, out of Galveston, Texas. So they have a longitudinal study that I'm still currently a part of, where they test every few years, just to see how porphyria patients are doing. And then there was another study where they would give you either panhematin or placebo, which would have been just the glucose. And they couldn't say if I. They told me if I got into the study, that they couldn't guarantee if I would get the panhematin or the placebo, but they said that I would be able to get some sort of treatment if I came out to be a part of the study. So I did go out to Texas, and that's where I was able to get the panhematin, on a regular basis through Dr. Anderson, and I forget the other doctor who was working with him, but it was a black woman. I believe
Right.
she was in training, working with Dr. Anderson,
Mm-hmm.
and I was able to. And after the study was over, they told me that I was one of the patients that was getting panhematin, and I kind of knew that I was because I was getting better. So that was.
Right, and I was on the phone with you quite frequently during that time,
Mm-hmm,
and you had started to not feel very well before going,
mm-hmm,
and so I didn't want you to go alone, but of course at that time I couldn't be there in person. I
mm-hmm,
had work and I had your little brother, so you you had to go to Galveston on your own, and you weren't doing well,
mm-hmm.
and you were blessed that you were able to get you got the actual medication, you
Mm-hmm.
didn't get the placebo, and you started to feel improvement. And I remember even you started to feel improvement and you went down and across the street from the hotel they had you in
Mm-hmm.
and went for something to eat. And
Mm-hmm.
I think you got ice cream or something.
I got strawberry ice cream at a
And
diner that was across the street.
yeah, and you were enjoying it. And you just don't know the feeling that I had. But I always try to keep it here, even keel. Um, but I was just so happy I could cry because I was like, she's able to eat the ice cream, you know, like they, I don't know. I just, me, I wear my feelings on my sleeve. But when it comes down to people and caring about them, whether it's my children or somebody else, like I want the best for others. And I apologize for skipping over that area. And I wish so much that I remember the lady's name because she was very, very consistent in calling me. And, if I ever called her, even after your trial, and I explained to her, like we were having a problem with the medication or whatever it was. And Dr. Anderson even called me
Mm-hmm.
and spoke to me directly. And I'm just so grateful for those who really, really do care and they want to help the porphyria patients. I am so grateful for them. And the one thing that I don't see is I don't see a lot of people who look like Jazmine who have been diagnosed. And I also don't see a lot of caregivers who are highlighted who are able to provide this care. And I understand that this makes everyday, just basic functions sometimes can be overwhelming. And even if you're someone who is somewhat under control, because Jazmine still suffers symptoms, um, and sometimes they're really bad. And again, I go back to this. Um, she goes to work. She takes care of herself, and she is prescribed medication for pain, and she's not always taking it. She's doing other things. She's using over-the-counter stuff. Like she'll call me and say, "Okay, Ma, I got Voltaren. I'm gonna rub this," and I'll talk to her, and maybe an hour or two later, she's like, "It's still hurting, but I'm gonna be okay. I bought some tennis balls. I'm rolling, under my feet, or taking a hot bath, or just any little small thing." So that's why I say they shouldn't naturally assume that everybody is sitting down just popping pills and trying to get high. They need to understand. And I don't know if it's that they need to give, because porphyria patients didn't create the drug epidemic, is what I'm saying. And so it's not the porphyria patient's fault that they're having these pains. And I really do think that, the minds and the people who are in control of treating them, they need to put something in place. And I would also like to see, again, when a porphyria patient walks into an emergency room and they have their diagnosis, and they have already been treated in a healthcare facility, I would like for it to be taught, and I'm sure they can have an in-service. They have them for everything else, that they can be taught, if it's just a briefing, that if we receive any patient with a chronic illness, but someone that is in the type of pain and the mental state that a porphyria patient has to go through, that they will look at the patient's history. They will contact the current practitioner, and they will find out exactly what that person needs. That patient should not have to sit in the emergency room and be spoken to like they're a drug-seeking junkie, that they can get this person their morphine, their Dilaudid, pain pump. Don't tell this person that you're coming in there and you're going to put a pill in their mouth. They may be hurting too bad to even swallow. Understand that their pain is not the standard pain. Give them what they need. They are in a controlled setting. What abuse can they do? They're not in control. The healthcare provider and facility is in control. They need to put them on the pain pump if that is what has worked, and when it is controlled, then wean them off. But don't allow this person to sit in the emergency room for 2-3 hours. Put them in the back room.
7-8 hours.
That has happened before. Put them in the back, and they have to sit for hours there, and they say, "Oh, we're waiting on a room." Well, guess what? The pharmacy at the hospital is open. Whether you're in the emergency room, you're in a holding area, or you're on the floor. If the patient's history shows that this is what gave them relief and this is what is treating them, then give it to them and monitor them. But don't allow a human being, I'm going to stress it again, a human being, not an animal. I wouldn't do it to an animal. They see an animal in pain, they give them something. Why not a human being? And as her mother, I love her with all my heart, and I'm going to fight forever for her. I want the best for her. And you know what? I want that same thing for every single other porphyria patient, because just because they're few in numbers, they didn't create the condition. So let's treat them that way. Treat them with dignity. Treat them with respect. give them the help that they need. And this thing about the medication is so expensive, I didn't even mention that. I was told, oh, it's going to be $8,000 per infusion at the time initially when she was getting it. And so that's going to be, if she's getting this, it's going to cost this and blah, blah, this and blah, blah, that. Guess what? Guess what? She's a human being. She's a human being. She was working at the time. She had insurance. What's the issue? What is the conversation about? It's a human life. This is somebody who's productive in society. Don't do that. I love my child. I love people. Even the people who have not treated her as they should have throughout this journey, I love them. I don't like their behavior, but I love them. And I want to see other healthcare providers do better. We all can do better. As her mother, there are probably things that I could have done better, knowingly and unknowingly. And whether like I said, others had to step in at times because I had to go to work. I had another younger child, and I wanted to be there, But, and there were things, like I said, when she was small, there were times when Jazmine, her airway did not stay open unless I sat with my legs folded, her on top of my legs, in the opening of my legs with a pillow bent over in front of her, and I'm giving her percussions in her back to keep her airway open and breathing treatments. And this is when she's only, a couple of years old, hadn't been in the world that long. There were times she went to the hospital and they couldn't find her veins. And they would tell me, oh, we're going to have to cut down in her ankles. We had no idea about porphyria then. And no one ever even looked in that direction. There were times when for months on end, I was going to the emergency room with her. Sometimes during the weeknights, and definitely if she made it to the weekend, I would sit there the whole weekend with her. There have been some times, and I even had a pediatrician that loved her dearly, and he tried everything he could. Everything. And he didn't even come up with the answer of porphyria. But he was always drawing her blood, and he was always sending it off, and he was always listening to her lungs, and he sat with her and he heard her out. He had excellent bedside manner. But we have to have people to care, because that's going to be the beginning of the answer. Because if people don't care, they're not going to ask the questions. They're not going to do the research. And now that we do know some things, we don't know all. We have to do the best we can with what we know, and we have to keep looking for answers. We have to. I think I've talked long enough, huh?
Well, I want to say thank you, Ma, for sharing, from your perspective what was going on. A lot of it, especially in the beginning, that's why I said I wanted to do this and also um, have it where I would tell my perspective and yours, because even some things when I was diagnosed in the beginning, I don't recall because of the mental state that I was in. I don't remember the things that happened or how I got to the hospital or what happened when I was at the hospital. There, different things that I just don't recall. So I say I thank you, um, for being there and being my mom first and being my advocate. And I just want to say I love you, because I wouldn't have got through this process without you.
Well, Jazmine, I see you as a gift. And I never saw you as a burden. any of my children. And I think you were given to me for a reason. That's number one. And I thank you for being you, because you say you don't remember a lot, but you remembered your mama. You told those people, I'm not talking to you. I don't care if you isolate me. I'm in pain. I need help. You had lost so much weight and you were confused, but you remembered that I was your mother. And that speaks volumes. And I love you. I'm going to always love you. And I'm not going to stop fighting for you. No matter what, I'm not. And, you know, family, hear your children. Because there were times even when I thought I was doing the right thing. And I would say, how are you today? And she got to a point where, leave the window, the door, leave it all open for them to say what they need to say to you. She was never disrespectful to me. She said, Mommy, I don't want you to ask me how I'm doing no more. Not every time you talk to me, because it makes me think about how I'm not doing, how I don't feel good. I just want you to be my mother and just talk to me about normal things. So, little things like that. Leave the conversation open and listen. Because sometimes you can help better when you're listening. Then your actions can adapt to such a way that can help them more. And I hope that this will help somebody. I've asked Jazmine for a while to speak about it, and she wasn't ready yet. And I don't know that I was even ready yet, but I wanted her to speak because I felt like her story might be able to help another person, another family, or even a healthcare provider who has brushed somebody like her off. And I'm just hoping for the best. And I think we got it. I think we got it. We don't have all the answers, but I think we got it. Um, we know what to do. We know to remain in faith, and we know to keep fighting. And I know you got it in you. And on my worst day, I still got it in me to fight for you. Yep, I love you, girl.
I love you too, Mom.